these are things that I find myself saying many times during the day. So you are divinely designed. You were designed to live in victory. Many of us are not. Many of us are struggling day after day, year after year. And the only reason I'm here is because of God. So he gave me this practice, and he sends all the men and women to me. So because he put me through a personal storm that he made a way out of. So I just wanted to say, if any of you are struggling right now, I'd like to encourage you to keep praying and praising through it, and he'll get you through it as well. Okay, next slide. So, let me introduce too. This is my husband, Mark. And so we have a family clinic in Springfield. And this is one of our sons, Nate. We have twins. The other one's on their way with his girlfriend. They're the health coaches. The three guys are the health coaches and the personal trainers. And then Mark is the office manager behind the scenes. So anytime you come in, you'll see any one of us. We have a nurse who is about to graduate from nurse practitioner school. And then we have a front desk receptionist, Janie. So we have lots of fun in there. Okay, so myths that are preventing you from going on hormone therapy. By a show of hands, if you feel like joining those kinds of games, how many have heard that hormones cause breast cancer? Whether or not you think it's true. And then how many have not gotten hormone help because of that? Yeah, okay. So you can still have hormones if you have breast cancer. You still have hormones if you've had a family history. So breast cancer, let's really talk about breast cancer. So if you drink alcohol, I'm going to suggest to you not to. One drink a night with ladies increases our breast cancer risk by 30 to 50%. That's a lot. There's not one drop of alcohol that you ingest that your body does not think is poison. It does everything it needs to metabolize that out of your body and get it out. So I would venture to say that alcohol is up there at the high causing breast cancer. And then the other big thing is insulin. So insulin, having insulin resistance, diabetes, and you can see insulin resistance coming for about 15 years before the doctors will tell you that, or your provider. But insulin, the top 12 cancers, 9 of them are insulin driven. So breast cancer's in there. So if anyone's afraid of breast cancer, there's never been a study showing hormones cause it, but I would look at your alcohol, your stress, your sleep, your insulin, your sugar, and that kind of things. You have a clotting disorder? No. You've been in menopause over 60 years, you've had a heart attack or stroke, or you smoke. So that's synthetic hormones. We don't use synthetic hormones. Next slide. So let's also talk about what's probably causing breast cancer more than hormones, for sure, maybe even more than sugar and alcohol. These are endocrine disruptors. And so this is by Anthony J. He wrote a book called Estrogeneration. And I found this book about a year ago because I was just like, this doesn't make sense that God made us with hormones. Hormones kill us. We have estrogen receptive breast cancers. I don't understand why. These are many of the reasons why, and these are what we're bombarded with every day in our life. And I'd like to point out atrazine, which is an herbicide that turns male frogs to females. So we have a problem with our environment. So again, never been a study showing hormones cause it. Other things we should be looking at. Next slide. So everyone's worried about the C word. It's super scary, and it is. I remember I was born in 1971 when my parents would come home and say, so-and-so has breast cancer or any kind of cancer, and so-and-so even has diabetes. You were like, oh, what? Now, we don't know anyone that doesn't have those kinds of things. But cardiovascular disease kills more women than all the cancers combined, all of them. And so you can see that's data from 2014. Of course, age 40 to 59, breast cancer kills 10,700, cardiovascular disease 10,000 and 22,000. And you can go down the ages. At age 80, of course, more women die of cardiovascular disease. But you can see it's cardiovascular disease, but we're not talking about that. It doesn't really instill fear, does it? There's really no actresses coming on TV and saying, I have cardiovascular disease. But when it's breast cancer, it's, splashed sensationally across the media. So epidemiology studies show that postmenopausal women given estradiol, which is bioidentical estrogen, has a reduction in cardiovascular disease of 40 to 50%. That's a major, major reduction when that's what kills us. Okay, next slide, please. So estrogen and progesterone, I'm going to hopefully go through these kind of fast to get to the case studies and stuff I want to get to. But when you Google estrogen, it is super confusing, because one time a patient sent me a article on estrogen, and I texted her back and I said, listen, I don't know what this article is talking about. Is it conjugated equine estrogen, which is horse pee, which is Premarin? Is it estradiol? Is it estriol, which I put on my face before I came here? Is it estrone? We don't know. Even the studies, it's hard to decipher unless you read the whole study, because there was a study done on progestins, which is Provera, medroxyprogesterone. And if you read the whole study, they're talking about Provera, they get to the conclusion and they say, therefore, progesterone is dangerous. Don't use it. They interchange progesterone and Provera, which is synthetic. It's not the same. So just be careful. Next slide, please. So why the bad rap? I'm going to go over this very quickly, because last week the FDA finally took the black box warning off estrogens. So it was there because of the Women's Health Initiative that was released in 2002. It was a faulty study. It should have been retracted a long time ago. So when people were asking my opinion, I was like, I'm super irritated it was there in the first place. I'm irritated it stayed there for so long. And I'm irritated now because we've missed millions of women going on hormones because now they're afraid. So the Women's Health Initiative was set to study in 1993, and it was a close to $1 billion study in 1993. It was set to study cardiovascular effects of postmenopausal women that started estrogen, and then those that didn't. When they got the women together in 93, they realized they didn't have enough women with heart disease, so they had to bring women in. These questions I ask you are not trick questions. Who do you have to bring into a study of women if you want heart disease? You have to bring in older women. Young women in their 40s and 50s don't have heart disease. So then that made the Women's Health Initiative mean age 63 to 64, because they had to bring a whole bunch of women from 63 to 71. So it skewed the results. Those women have heart disease already. They were smokers. They were overweight. It was just a terrible study. But nonetheless, the next year, estrogen got a black box warning on it, even vaginal estrogen, which everyone could have and should have. But everything that was called estrogen has a black box warning on it. So the WHI studied Premarin pregnant horse pee and Provera. The other name for Provera is medroxyprogesterone. So everyone gets it confused, even the GYNs. Progesterone is what women make lots of to carry babies to term. And Provera is like eating an apple, and I ask how your apple is, and you tell me it's a banana. I would be like, well, it's not. It tastes different. It smells different. It looks different. It's a different color. Like, it's different. So, okay, next. So I think you can go to the next slide. So estrogen's black box warning has just finally been removed. Again, why was it on vaginal estrogen? The other interesting thing is there was a black box warning on testosterone for men as well for a bad study. That was debunked a long time ago, but quietly the FDA took that black box warning off in March of this year. So, okay, next slide. You can go to the next slide, I think, and the next slide. Okay, so there is provider resistance to hormones. In my personal opinion, so we don't learn it in school. It doesn't matter what kind of school you go to. And I have up there, Pearl Clutch, GYNs do not learn hormones, which is just, when you think of women's problems, what doctor do you think of? Gynecologist, right? It's not trick questions, but they didn't learn how to take care of us once we stop having babies. Once we stop having babies, they don't know what to do. They're just like, I don't know, you people are crazy, because we kind of are. But we're even more crazy when we try to live without hormones. But so because they don't know, I think there's an ego involved, and they don't know how to do it. And so they don't want to even act like they don't know, because I have, over the years talked to many MDs, and they've kind of been taught that they know it all. What they say goes, and the buck stops right there. Don't even try to go ask anyone else. And now they're super irritated with Google and people like me talking to people like you, and they don't like all that. Most providers still think hormones cause cancer, and our medical system, bottom line, is set up for chronic care and not preventative. So they are not in the business of healthcare. They're in the business of sick care. So, okay. And then, you don't have to go back. But the other big thing is, because of the Women's Health Initiative, we've gone 23 years thinking hormones cause cancer. So that's 2.5 decades. We have no providers prescribing hormones. So they don't even know how anymore. Even if they wanted to, they don't know how. And some hospital systems don't allow them to. So that's what happened. Many times when you ask your provider about menopause, so the two things in the middle I want to talk to you about is they don't recognize perimenopause. So the average age of menopause is about 51. Perimenopause happens about 10 years before that. Menopause can last about 10 years after that. So some women are suffering for 20 years. And doctors are just gaslighting and gaslighting. And when I say doctors, I also mean any provider. So if you do get someone to listen to you and say, okay, well, let's check if you're in menopause, all they do is this FSH level. That's a follicle stimulating hormone. If you're above 50, you're in menopause. But then most of the time they say, you're in menopause. And the woman's like, well, what do I do? You're in menopause. It's a rite of passage. It's a way of life. All women have to go through it. And so I just say it's diabolical how providers talk to humans. And I was just telling Shayna, I wanted to be not as lippy because I've just heard some things that are terrible. And then she told me her story and I was like, oh, I can't do it. Never mind. So, okay, go to the next slide, please. If I had $1 for, because inflation, we can't save 5 cents like our grandparents did or our parents. But if I had $1 for every time I hear this, so you're too young to have hormone problems. One of my case studies is a PMDD. And let me just tell you quickly about PCOS, which is polycystic ovarian syndrome. I had a patient, she was 29. I've seen her mom for like 10 years. I saw her dad before he died of esophageal cancer or throat cancer. Now I see that was about 5 years ago. Now I see the mom's new husband. So she sent the daughter to me because she has one baby. She can't get pregnant again. She went to her GYN after a year. He said, you're fat. You have to lose weight and you'll probably get pregnant. And she's like, I know I need to lose weight. I don't know how. He said, eat healthy whole grains and fruits, which we could do a whole nother talk about because that's our specialty also. So she came to me. Her A1C was completely fine. That's the diabetic marker. But her fasting insulin was in the 30s. I put her on low carb. She came back in 2 weeks. She had lost 15 pounds. She also had, because the root cause of PCOS is insulin resistance, she lost 15 pounds. She had terrible anxiety. She's on like 3 different meds. She got off one med and her anxiety was much improved. And then 2 weeks later, my receptionist came in and said, I think you want to pick up the phone and talk to this name. So I did. And she said, I love you so much. I'm pregnant, but don't tell my mom yet because I haven't told her. So, but you go into a GYN with PCOS, you're getting the birth control pill and you're getting metformin, which sometimes metformin will help you get pregnant, but you don't need testosterone because you're not having sex. Hormones cause cancer. So I have a 70-year-old patient who just came to see me this summer. She had a total hysterectomy at 39, was never given hormones because her doctor said, his words, don't take hormones, you'll be eaten up with cancer. So she didn't take hormones. 10 years later, she got colon cancer, which estradiol helps prevent. 5 years after that, she got breast cancer. So she sat in my office. She was pretty peeved. And she's like, I want hormones. It's a rite of passage. All your labs are normal. All your labs are normal because even when I see postmenopausal women, their estrogen and their progesterone level is 0. I mean 0, but it doesn't flag as low. It flags as normal. So yes, their labs are normal. Someone finally listened. I finally have hope. I mean, it's just, it's too many things. Oh yeah. And then my other patient came to me. She's been with me about all 10 years. She's 70. She was 72 when she came in. Hot flashes and night sweats every day of her life since she was 52. At what point is it going to pass? They tell you it'll pass. It'll pass. Well, that was 20 years. Okay, next slide. Okay, so progesterone. This is an amazing hormone. It's the first one to decline with testosterone. It is the hormone of contentment, helps with anxiety, depression, sleep, evenness of mood. She protects your breast from breast cancer. She aids estrogen and heart health and cholesterol issues. And so if you don't have a uterus, you don't get progesterone. Anywhere in there, I did not, anything I just said, I didn't mention the word uterus. But if you don't have a uterus, you don't get offered progesterone. They think progesterone is only to protect the uterus from estrogen. That's not true. I say when this hormone goes, we get crazier than God made us. Everyone likes our crazy, but when we go into menopause or perimenopause, we get crazier than God made us. Okay, next slide. So at this stage of life, women get offered antidepressants, anti-anxieties, and sleeping pill because suddenly you can't sleep. Progesterone's amazing. Don't let me live without progesterone. Progesterone is huge for PMS, PMDD, which we'll talk about in a case study, PCOS. Any woman with history of PCOS or history of miscarriage needs to be on progesterone for pregnancy. And you need to stay on it until about 37 weeks. Don't let them take you off after the first trimester. Okay, you can go to the next slide. Testosterone's amazing, but now what they're telling women is you're going to grow a penis. And I'm just like, on what planet has that ever happened since the dawn of time? Testosterone and thyroid are the feel-good hormones for men and women. Testosterone is sex and muscles. Everyone knows testosterone grows your muscles. That's why men are stronger than us. And everyone knows that it's a sex libido, sex drive. But it's also zest, vitality, motivation, strength, stamina, get up and go, get your list done, anxiety, depression, blood pressure, cholesterol, heart disease, protects your breast against breast cancer, but you might get a penis, so we're not going to give it to you. Huge with autoimmune disorders, which I have one, huge with inflammation, arthritis, so we want that. Okay, next slide. You can go to the next slide. Estradiol. It's so sad. When we go in menopause, we have less estrogen than a man does. In fact, I just checked Nate and Blake's labs, and their estrogen was like 30, 32. A postmenopausal woman is 0. So men are walking around with more estrogen than we are at menopause. And also, just for vocabulary's sake, perimenopause happens when you get to the 365th day with no period. That's menopause. When you get to 366 days, that's postmenopause, okay? Kind of dumb, but if you're talking to people, sometimes that gets providers a little aggravated. So estrogen helps with hot flushes, night sweats, vaginal dryness, painful sex, osteoporosis, which we've reversed in the office, heart disease, obviously we talked about that with the first slide, and Alzheimer's and dementia. Your brain has so many estrogen receptors. When you lose estrogen, that's when women's brain goes from those organized compartments, we can find everything, to I have no idea what's going on. I have no idea what's happening. I don't know why I'm in this room. And so you don't want your brain to be without estrogen receptors because you don't want those receptors to shrivel up and not come back. So, so when this hormone goes, women lose their give a crap. So this is, which we're going to talk about in case studies, is when, in my opinion, marriages fail because women are struggling. We're struggling, and we are gaslit like crazy. I feel like there must be a gaslighting 101 class in med school, right? You laugh, but it's true. Okay, next. So if you have a clotting disorder like factor V or prothrombin, you can still go on estradiol. So that's what that first slide about the myths. And vaginal estrogen should be given to everyone that needs it, and it should be at nursing homes because frailty and urinary problems are the reasons women go into the nursing homes. And so if you complain about vaginal sex, and there's a case study, one of my patients told me having sex is like he's cutting me with glass, and I make him, we only do it at night, so the lights are out so he doesn't see me whimper. But a physician is going to tell you you're not having sex or you don't need it because of what? Like some women can feel that vaginal dryness even without having sex. Okay, you can go to the next slide. These are the symptoms I hear every single day from all stages of life. So you guys can just read through that. One I thought of I should have put up there was palpitations. That's one I hear a lot. And your ears get itchy on the inside. That's another one I hear a lot. But when a woman walks into a person of authority, like a provider, and says, I'm falling apart, I'm a shell of myself, I don't know who I am, I want to move to an apartment away from my family, I can't stand them, I can't do my work anymore. You know, I have like attorneys and other kinds of high-functioning people that they can't do their job anymore. And we tell them, that's a part of life, you're just a woman, that's what everyone goes through. That's what I mean. Like, I don't know how people talk to humans like that. Yeah, and then I have people tell me all the time, my house is messy. I just can't do any of that stuff. It's too much. It's too overwhelming. So all day long, this is what I hear. That's why it's hard to have grace. Um, okay, next slide. Okay, so we're going to take age groups of 5 years, and I'm going to tell you what commonly they're complaining of, and then I'm going to give you a case study. So I think things start to go awry between 30 and 35. If you have PMDD or PCOS, endometriosis, those things can decline your progesterone way before now, but this is when the majority of women start to feel problems. And what I hear is, I can't focus, I feel like I have ADD, I can't concentrate, I have brain fog, and then low libido. Libido is hard for females also because, men think about food and sex. Women think about everything, but we think about food. So we think about, did we leave some clothes in the dryer? Did my husband eat a bowl of ice cream and leave it in my clean sink? Do the kids have clothes for tomorrow? Are my parents okay? When did I check? I mean, we're thinking of all of these things. Men are not. They're thinking of food and sex. So when you go to the provider at this stage, you laugh because you know it's true. And they get diagnosed. First of all, everyone's told you're getting old. To be fair, the first person that I heard tell me that was 37, okay? But this is 30 to 35. But they always say you're getting old, you're a mom, and then this one gets diagnosed with ADHD. So the treatment they give her is Adderall, and she gets told, try a glass of wine for the low libido. So Adderall side effects are jitters and trouble sleeping at night. So now we're creating a second problem, right? Case study. So this woman, 36 years old, came into me in July of 2023 for heavy periods, awful, heavy, painful periods, menstrual migraines, severe PMS with depression and anxiety that presented after her second child was born. She said she only gets 2 good weeks a month, which I just had a patient that told me she gets only 3 days a month that are good. She's missing life and she has severe moodiness. She came on 4 antidepressants and anti-anxieties, 4. And she's 36. I diagnosed her with PMDD, which is premenstrual dysphoric disorder. And so those are the women that want to unalive themselves during their periods. They become so depressed and so down that life is really, really hard. So I diagnosed her with PMDD, and my treatment was oral progesterone and a little supplements. And I go by supplements based on labs. I don't just dole out like 30. I just have you go based on labs. So, okay, next slide. On follow-up, all quickly improved. Now menstrual cycle is much more manageable. PMS and moodiness better. She ended up leaving me because what happens when we feel better? We think, did I really need that anyway? I probably wasn't thinking, it probably wasn't as bad as I thought. So she left, and then she ended up coming back a year later, realized that she was being helped so much. So we put her back on progesterone, and now we're trying to get her off of all of these 4 medicines for the same thing. She said they make her feel numb and apathetic. 1 in 4 women at the age of 40 are on antidepressants because depression and anxiety wreak havoc on us. However, hormonal depression does not respond to antidepressants. This is the age group where women unalive themselves. And when you go on an antidepressant, the side effects is homicide and unaliving yourself. So we have to do better. Okay, next slide, please. So the next age group, 35 and up. So it's always the same symptoms before, but increased new anxiety, low sex drive, feelings of despair, moody, irritable, more rage, and weight gain. So they get diagnosed with depression. You're getting older. You're a mom. This is life. They get prescribed, RX is prescribed an SSRI. Again, the SSRI side effects are decreased libido. So she complained of libido. Now she's going to have a decreased libido. Weight gain. No one wants to have sex when they feel fluffy. Difficulty orgasming. And then, so these meds can be extremely difficult to get off of, which we don't tell people, which now they're starting to figure out. You have to take about 2 years to get off the antidepressants. But anyway, she gets prescribed an antidepressant, plus she's still on Adderall, remember from before. And then my case study is I had a 38-year-old patient with a history of hypertension. She came on atenolol for the hypertension. She complained of struggling the last 2 years with weight gain, joint pain, hard to get out of bed, fatigue, low libido, brain fog, and cold all the time. I diagnosed her with Hashimoto's, which is autoimmune thyroid, which I have myself, and I diagnosed her with perimenopause. But she's too young to have hormone problems. She's only 38. Okay, not in my office. So I prescribed her compounded thyroid, compounded progesterone, testosterone cream, mag, zinc, vitamin D, and vitamin K. And then at follow-up, she's better. She has better energy. Joint aches better. It's hard for me to read these without my allergies acting up, honestly. She's going to the barn, riding her horses again, has desire to do things, playing catch with her daughter. She's been with me for a while now, and she ended up losing 70 pounds on hormones, just cutting out junk. When you are deficient in hormones and you're not sleeping and you're really stressed, and because life is stress, you activate cortisol. Cortisol gives you belly fat. So you can be doing the same exercise, which might be none. You can be doing the same food, which could be junk, but you're going to start gaining weight. After 40, that's how it works. Okay, next. So this is 40 and up. So these symptoms are all the ones from before, but fatigue, hard to get out of bed, zero libido, starting to cause marital issues, muscle aches, insomnia, anxiety, depression, worry, sense of impending doom, weight gain, unable to handle ordinary tasks, and life is overwhelming. She goes into the provider. She gets told her diagnosis is you're old. She gets diagnosed with fibromyalgia, anxiety, and depression. And we all know women are histrionic. So she gets treated with Cymbalta or gabapentin, which Cymbalta is an antidepressant that is supposed to help with pain receptors, and then gabapentin, which both cause insulin resistance, Xanax, and a sleeping pill like trazodone, which can also cause insulin resistance. And women 40 and up are insulin resistant because they don't have hormones. She's told to get counseling for the sex drive. She's told to eat less and move more for the weight gain. Like, we all haven't tried that. So the case study for this one, TM. Those are my initials. That's interesting. Consulted November in 2013 with a physician in Florida. She was 42, had history of hypothyroid, Hashimoto's. She was on levothyroxine. She had severe apathy for life, weight gain, severe libido, zero libido, anxiety, irritability, yelling at her kids over kindergarten homework. I'm sorry, Nate. Unable to sleep, overwhelmed with life, difficulty getting out of bed, loss of muscle mass, unmotivated to do anything, didn't care if she lived or died. This is me. So I was diagnosed with perimenopause, hypothyroid, and Hashimoto's. They changed my levothyroxine script to an Armour script, which is the natural desiccated thyroid, which probably some of you have heard of, and that's what you need to be on if you have thyroid disease. I was also given oral progesterone, testosterone cream, and DHEA. And then months later, I felt amazing, great sleep, ready to get out of bed, see what the day brings. I remember thinking, who are you? As I thought that in the morning. Better libido, started losing weight, started working out again, building muscle, found joy, motivated, went back to work, and eventually built an amazing business where I help men and women get their lives back. Mark said to me, I loved you before, but man, this is easier because we become hot messes and we can't help it. I mean, low progesterone, you're like saying, don't say that, don't say that, don't say that. There it went. There it went. I said it. And everyone's looking at you like you're crazy. Everyone knows women are histrionic. Like, it's a big deal. Okay, next. Age 45 and up. This, to me, is when marriages really fall apart. And honestly, a lot of it is because we have kids and we've focused on the kids and put our marital problems, swept it under the rug. And now you got this big mountain under the rug. And now you're feeling like a hot, hot mess. Again, estrogen is all over the place, and this makes women much less tolerant, less accommodating, less able to roll with things, less flexible. Women start to speak their truth. They start to put up boundaries when suddenly you let them walk all over you. So why are you now telling me stop or telling me no or telling me whatever? Hi, guys. Okay, so the symptoms are, in this age group, your cholesterol increases. You have zero libido still, but now you have osteopenia, which is the precursor to osteoporosis. Brain fog, trouble finding words, hot flashes and night sweats, feel like a shell of themselves, and overwhelmed with all the previous symptoms. So when this girl goes to the doctor, she gets prescribed statins, which I think are very dangerous, a second antidepressant. She's told to get better lingerie for the libido. I was like, your husband would love that. Told to put the fork down and push away from the table for weight gain. Like, we haven't tried that. Okay, next slide. So case study, a 48-year-old woman came in to see me. She had higher levels of testosterone in college, and she was on spironolactone. Her heart stopped during C-spine surgery, which is a neck surgery, and she had a loop recorder planted. I'm only telling you that because providers would be like, I don't know if you can have hormones, so you can't, because I don't know. And instead of saying, I don't know, I'm going to say you can't. So they precluded her from having hormones. My consult was in October of that year. She complained of hot flashes, night sweats, insomnia, brain fog, low libido, fatigue. She had seen her GYN in 2021 due to heavy periods and frequent periods. The GYN said she was in perimenopause, and he put in a Mirena IUD, which is a progestin IUD. And then she had labs again before she came to see me, and he said, yeah, you're in menopause now. Your FSH is above 50. But he didn't do anything, just the IUD. Thank you for laughing, because it's ridiculous. My diagnosis is postmenopausal, right? Because she had been a year without a period. And I treated her with oral progesterone, oral estradiol, testosterone cream, DHEA, homocysteine support, and D and K. Homocysteine is a amino acid buildup that I check for in your blood, and it can let us know if you're set up for heart attacks, heart disease, or dementia. And if any of you have heard of the MTHFR gene variant, it's probably associated with that. So she came back the next January of 2024, feeling much better, sleeping through the night, no hot flashes and night sweats. Listen, I'm not saying hormones will cure everything. I'm saying hormones are really important to help you cure everything. So they are bullets, but they're not always a magic bullet. But if that's what you're really missing, it is a big deal. This seems so easy, and this is the majority of my practice. And just a couple weeks ago, I walked out and I was like getting ready to open the door with this patient, and I just looked at her because she had only been, I saw her back in 3 weeks. I put her on hormones. So when she came back, she'd been on them for 3 weeks and she already felt better. And I said, I didn't graduate at the top of my class. Like, I'm not the smartest one in the whole world, but this is, women were made with hormones, and when they lose it, things happen. When they do studies, on drugs and stuff, we aren't included, women, not until the Women's Health Initiative. And Congress had to pass a law to make us into the studies. They don't like us. Researchers, drug companies, they don't like us because all through the month, our hormones are up and down and up and down. And we metabolize drugs differently depending on the time of month. But if we were meant to have hormones, and that is what's zero, why would we be giving all this other medicine rather than just trying some hormones? Because we're scared it causes cancer. Okay, next. So age 50 and up, same symptoms as before, but now full-blown osteoporosis with vertebral fractures. There was about a 2-week period. I had 4 women come in that were under 50, like right around 48 to 50, and they had spontaneous vertebral fractures as they stood up, which is terrible. It's going to land you into the nursing home. Hot flash or hypertension, hot flashes and night sweats, bladder issues, incontinence, interstitial cystitis, UTIs, vaginal dryness, painful sex, like glass cutting when you're having sex. And that's my patient I told you about. She had sex with the lights out because she didn't want her to see her husband to see her cringe in pain. Diagnosis, it's always you're old. Use lubrication for sex. They would prescribe her lisinopril for the blood pressure, Prolia injections for the osteoporosis, Macrobid daily for the UTIs that she's constantly having now. And then she's told to go on date nights for the libido. I love steak, but there's no steak in the world that's going to help you feel like you're not cutting glass with your vagina with sex. Even a tomahawk steak. Okay? It's ridiculous. And then she was told to one of my patients was told, get a fan for the hot flashes and night sweats. I said, what if you're at Christmas morning with your grandkids opening presents and you have a hot flash? You're supposed to run to the shower and take a cold shower. Just say nothing. Just say nothing at all. Just say, I don't know. That's all. The Prolia for osteoporosis side effects: rebound fractures, jaw necrosis, increased cholesterol, UTIs, loosening of the teeth. Dentists always want to know if you're on Prolia or Fosamax because you can have spontaneous jaw necrosis, crumbling of the jaw when they're working on you. And then there's a black box warning on Prolia for low blood calcium. Okay, next. So my case study, this woman is much newer to me, obviously, because it was this year. She's 50. In the consult, and I do handwritten charts still, and so I just write quotes and I write everything the patient tells me. She said, everything is hard. Doing dishes is hard. I exploded in rage at my husband and son this morning when I was talking to her after I called her. I cooked them dinner last night and left the house for an event. The next day, which was the day I was talking to her, my son told me what time they ate. I exploded because it was later than I expected them to eat. Like, on what universe do you care when your husband and son ate when you're out? But this is being a hot mess with no hormones. So she also has low energy, weight gain, hair loss, hot flushes and night sweats, zero libido, rage, moody, irritable. Everything makes her want to explode. Brain fog, chronic UTIs, vaginal dryness. Her menstrual cycle's been irregular for 2 years. Okay, so this is straight out of my patient's chart. This is what I'm saying. Like, you could guess what everyone is going to say. And when I don't hear it, I'm like, do you have brain fog? They're like, yeah, brain fog. I forgot to tell you brain fog. I mean, I could tell people what they're experiencing because it's the same. Again, I didn't graduate at the top of my class, but this isn't super hard. I diagnosed her with perimenopause. So the problem in corporate medicine, I call them corporate because they're interested in corporate profits, not healthcare. And so in corporate medicine, the standard of care is an estrogen patch and 100 milligrams of progesterone if you have your uterus, and no testosterone. Okay, so because she's 50 and she's having hot flashes, night sweats, and vaginal dryness, they're automatically going to assume she's in menopause, and they're going to give her estrogen, which would be a very terrible thing. You are going to make her feel way worse, and that is not what to do. So that's why I put up there, don't let this age group fool you into giving them estrogen. So some people come in to see me and they're already on estrogen because providers will just slap that on you if you're complaining like this and you get loud enough and you say it often enough. I diagnosed her with perimenopause. I put her on progesterone, testosterone cream, and then she came on appropriate supplements because there's a provider who always refers to me from Florida. We're licensed in both places, and she does a great job. She just can't prescribe the hormones. Follow up in August, hot flashes are gone. I can look around and see a lot of us in here have experienced hot flashes and night sweats. Okay, they're not fun. They're not fun. So hot flashes gone immediately. Those go away within 7 to 10 days of estrogen. Mood and irritability is better, not as sluggish. UTIs decrease, vaginal dryness better. No change in libido, but then she told me she's not consistent with the testosterone. So we're going to work on that. What was I going to say about that? Shoot, I forgot. I need hormones. Okay, next slide. Maybe I'll think of it. Okay, age 55, same symptom as all the women since they were 30, but now you have insulin resistance, high blood pressure, pelvic pain, so that's called genitourinary syndrome of menopause. This is thinning and inflammation and drying of the vaginal walls and bladder. It affects the vagina, the vulva, which is the tissues around, the labia, or the lips, and decreased clitoral sensitivity with decreased responsiveness to sex. Okay, this isn't fun for men. Like, our men think about sex and food, and now it's difficult to have sex. So urinary incontinence and UTIs, along with frailty, is what lands us in the nursing home, us women. So we need to fix that. When elderly women or men get UTIs, it makes them very confused. I remember it lots when I was a floor nurse in the hospital. So you want to make sure that that's under control. I think, no one asked me though, I think vaginal estrogen should be a standing order at the nursing homes. I think everyone should get that. Diagnosis when they go to the provider, you're old, and why would you want to have sex anyway? Because our men want to have sex. and we should want to have sex too, because it helps our marriage. It helps us be vulnerable with the person we trust. She's the diagnosis, which has been told to women before, watch porn for libido, and right, which porn destroys marriages. So a GYN, my patient just told me this, so I went and added it to my talk. She's 77, her husband is 79, they're both my patients. She went to get a pap smear, and she said the doctor was a female GYN. She kept saying, how old are you again? Do I have your age right? Are you sure you're 77? Your vaginal tissues look so great and pink. And she said, yeah, and we have awesome sex. She said, I don't want to have sex past 60. Why? And my patient said, it's better than ever. What are you talking about? So these GYNs, even females, you're going to them because you don't have libido. She doesn't want a libido. She wishes she didn't have one. So these are the people you're going to trying to ask for help. I say most of these GYNs also need hormones. Okay, go to the next slide. So the case study. So this patient is 55. I see her and her husband. I started seeing them in 2020. She had a history of PCOS. She has hypothyroid. She was already on Armour, which is good. She had been low carb for a few years and even carnivore, but she was still unable to gain muscle or lose weight. She had no energy, no motivation, painful sex, vaginal dryness. She was newly married and in love, went into menopause at age 51. All these case studies, too, are not hysterectomies. But the same thing happens with hysterectomies. So I diagnosed her with menopause, hypothyroid, and her PCOS that she came with. I treated her with progesterone, estrogen, testosterone cream, DHEA, zinc, homocysteine, and D and K. At follow-up, which she's been my patient now for a long time, she feels great. She's coping better, happy, better energy in the gym, increase in muscle mass, libido's better, feels sharper, content and young, sleep better. And this part of this talk I had done in April, and literally a week after I've completed this, she texts me. I have patients text me all the time, like, happy 5-year anniversary, I love you. It's so sweet, and it's so wonderful and fulfilling. But here's her text verbatim on the next slide. I'm going to try and, nobody cut onions while I'm trying to say this, okay? Teresa, it is the eve of my 60th birthday. 3 years ago at this time, I had a broken arm. I set a goal for 15 pull-ups in one set by my 60th. So much has happened since that day, including losing my dear brother just 2 days before he turned 60, and my mom's dementia taking over her brain so that she doesn't even know it's my birthday tomorrow. Yet here I am at the gym just now getting 15. This feat may belong to me, but it really belongs to you. Without you and the help and guidance you've given me, I do not know what this birthday would have looked like. I'm happy, in love with my husband, strong, and mostly grateful. Thank you for being in my life. That's amazing. And that's what I deal with all day long. I have chills. I always, because these women go to their providers. Why do you want to have sex anyway? It's a part of life. You're a woman. You have to deal with it. Why? Why? If we can have this, why would we not want it? If you don't want those things, fine. But without hormones, your bones are going to deteriorate, your heart and your brain, and things are going to suffer. Okay, next slide, please. 60 and up, same issues, plus now significant hip pain, arthritis, worsening osteoarthritis, imbalance, risk for falls. So estrogen can help you with macular degeneration, colon cancer, and balance issues. Frozen shoulder, and then, of course, increased frailty. Diagnosis, you're old. Always you're old. And given more meds. My case study, this one was an amazing one. So she was 60 years old. Her son, I see his in-laws, and I've seen them for a long time. She had a history of hypothyroidism, digestive issues, and hypertension. She was on levothyroxine for the thyroid, Zofran because she had underlying new onset of nausea all day long, trazodone, which is a sleeping pill, and Vraylar, which I didn't know. I had to look it up. It's a schizophrenic drug with a black box warning for elderly patients, and I will tell you that 60 is considered elderly. Right? It's terrible. I was saying the other day, it's been a while now, but at my office, and I was like, being that I'm middle-aged, because I'm 54, and my nurse, who's in nurse practitioner school, she goes, middle-aged is 38. And I was like, you stop it. She said, because the lifespan is 76, middle-aged is 38. And I was like, don't ever repeat that again. Don't ever say that again. Okay, and so there's a black box warning for elderly patients with dementia. And the other thing Vraylar does is it can cause strokes. So CVA is a stroke. QT prolongation has to do with your heart rhythm. Tardive dyskinesia is where you get weird like movements with your body. Insulin resistance, weight gain, which worsens insulin resistance. Sounds like a great drug. Her digestive issues cause low-level nausea all day long. She had lost a ton of weight because she can't eat. She had natural menopause at age 50, just meant she didn't have a hysterectomy. Last 3.5 years struggling with depression, withdrawing from social events, social anxiety, crying, fatigue, no motivation. This is the kind of consults that I'm really like, Lord, I don't know why you brought this person here. What am I supposed to do? Like, that was a lot to unpack in that room. And also, I don't know how to explain it, but just her energy was like, it was different. So I diagnosed her with menopause, and then she already had the hypothyroid, hypertension, and digestive issues that I had no idea how to help. I had no idea. So next slide, I put her on, I added Cytomel or liothyronine, which is the T3 portion to the levothyroxine. If you're on levo, that's fine, but you have to be on the T3 portion. That's where all the symptoms get better. I gave her oral progesterone, oral estradiol, testosterone cream, DHEA, B12, and vitamin D and K. She came back a few months later, and she was a completely different person sitting in front of me, and I was shocked because I didn't know the digestive and the nausea all day long. Oh, look, I even said I was shocked. I was shocked. She was like, she said, thank God, I'm thinking God. She just kept saying it over and over. She feels better, more energy, libido is great, husband's not, appetite better, gaining weight, and decreased anxiety. Oh my goodness. This is amazing. Why aren't we doing this? One of the reasons I think is bioidentical hormones I get from a compounding pharmacy. They're not that expensive. Like me just ordering my hormones or paying for them through the pharmacy, I'm not making them rich. It's $101 for progesterone for 3 months. It's $51 for testosterone for 3 months. And it is $78 for estrogen for 3 months. If you went on hormones, compounded, you're not feeding into the system that runs the world, which is food, pharma, and ag. When you go on hormones, you get better. But if you stay in the system, you just get med after med that's compounding side effects. Then you got to figure out what's what. These medicines have never been studied together. So they might give you lisinopril for blood pressure and trazodone to sleep. They've not studied those two together, and certainly not with women because they don't like us in research. So, okay, next slide, please. If you follow the advice from where we started, which was age 30, you would now be on 6 to 9 medications. None of these address hormone deficiencies. Now, I'll tell you, I have boys. Boys don't care about hormones. They don't care about much. But even my boys, when they were younger, would have known that women have hormones because they hear me talking. And that God did not design us with Lexapro receptors. We aren't deficient in Prozac, or we're not deficient in Macrobid. We have other issues going on. So the best thing to do is find a qualified BHRT provider. That means going out of your insurance plan. That means you're going to have to go pay cash pay 95% of the time. I say, this is not a trick question. If all of us here got $5 million, well, more than that, so we could live under our means. We all had $10 million. We're going to build a $5 million house. And now it's time to do the plumbing. Who are you going to call? A plumber. When you go to your doctor or your nurse practitioner and you ask them about hormones, it's like you called up a neurosurgeon and said, hey, I want you to plumb my $5 million house. They're not going to do that. So when you go to a provider and you ask for hormones, remember, even GYNs don't learn it in school. They don't know what to do. They aren't interested in helping you. You're asking the wrong people. So again, remember, yeah, they don't learn it in school. These are a couple books that are out. So first of all, The Estrogen Matters is an older book, but Dr. Blooming is an oncologist whose wife had breast cancer, and he told her, you can never go on hormones. This is the way life is. She went to him. There is a story in the book. I think she went to him and said, I might kill you or somebody else. So he went and looked up how can I help my wife? And was kind of appalled that he parroted what he parroted for years about hormone and breast cancer. You can choose not to go on hormones if you've had breast cancer, but that's a choice. That's not because you've had breast cancer, you can't have hormones. That's a choice that you're going to have to make. I'm pretty sure that's it. Yep. So this is a way to get in touch with us. I really appreciate you guys listening. I hope it helped give you some clarity with some stuff and just kind of just have the information. How are we supposed to know if we don't know the information? Okay, that's it. Thank you so much.